Today is November the 8th, 2015, and here's another article over on UPI, CDC, gonorrhea becoming more resistant to one antibiotic. The drug is not the primary treatment for the STI, however, it could be an indicator of issues with others used to eliminate the disease. This is by Stephen Feller, so all credit goes to him. And let's go ahead and dig into this. Washington, November 4th, UPI. An antibiotic treatment for gonorrhea was found by the Centers for Disease Control and Prevention to be losing its effectiveness, although researchers at the agency said while this is cause for concern, the drug is not the only way to treat the sexually transmitted infection. Gonorrhea is spread through unprotected sex and, if untreated, can cause serious health complications. The STI can effectively be treated with antibiotics. However, at least one, cefixima, and I hope I'm saying that right, appears to be losing its efficacy. According to the CDC, the infection's resistance to cefixima went down from 2011 to 2013, but the drug disappeared to start losing effectiveness in 2014. The drug is not the primary method of treating gonorrhea. Guidelines issued in 2012 recommend a ceftriaxone-based combination therapy that remains effective. It is essential to continue monitoring antimicrobial susceptibility and track patterns of resistance among antibiotics currently used to treat gonorrhea. Dr. Robert Kirk-Cawley, an epidemiologist at the CDC, told Health Day, recent increases in cefixima resistance show our work is far from over. Researchers at the CDC looked at samples from 51,144 male gonorrhea patients gathered at public clinics between 2006 and 2014. Of the samples, 1/3 were from the western part of the United States and 1/3 from the South, and about a quarter of them were drawn from gay or bisexual men. The amount of patients given the combination therapy increased from 9% in 2006 to 97% in 2014 as a result of the change in treatment guidelines in 2012. The researchers found that resistance to cefixima increased from 0.1% in 2006 to 1.4% in 2011, before dropping to 0.4% in 2013. However, resistance began to increase again in 2014, rising to 0.8%, raising researchers' concerns. Trends of cefixima susceptibility have historically been a precursor to trends in ceftriaxone, Kirkcaldy said, so it's important to continue monitoring cefixima to be able to anticipate what might happen with other drugs in the future. Well, I was just reading an article as it related a few months back to antibiotics that they are using in the meat. They're using the same antibiotics that they used basically to treat STDs, basically as a fattening agent, to grow more meat on cows and in pigs and so forth. And so, could the two have a link? I'm just connecting the dots here. I'll let you decide, and I'll put the links down below in the description section. As always, leave some comments, share your thoughts, and that's going to do it for this report. See you in the next article. September Man out.